joining us. If you're one of the many people stuck in contacts or eyeglasses with hopes of one day seeing clearly, our next guest says you can fix your vision. Here to tell us more about the procedures is Dr. Mark Lobanoff of North Suburban Eye Specialist. Doctor, thank you for joining us. Very exciting topic. Lasik technology, which we're here to talk about today, has really exploded over the past few years, hasn't it?
It certainly has. Lasik really came on the scene back in 1999, and it's been a great technology for millions of Americans to help correct your vision. But over the last 10 years, there's been a tremendous number of advances, not only in LASIK, but in some other refractive lens technologies. And one of the things that I hear when I'm out in the public is patients who have some misconceptions as to what LASIK can do these days.
So let's talk about the people that might be candidates. What type of eye ailments will LASIK help?
Nowadays, we can correct virtually any refractive error. So there were times in the past where patients were told if you have astigmatism, it couldn't be corrected, or if you had bifocals or a need for reading glasses, you'd be stuck wearing those. That's no longer true.
So just about anybody that wears any type of eyewear, whether it be contacts or glasses, can have their vision corrected through LASIK surgery.
Most can have it corrected through LASIK surgery. Now, there are a few patients that are not candidates for LASIK, in which case some of these other newer technologies are a great option.
What did you bring with you here today?
Well, first off, I would like to show you this new lens known as the Visian ICL.
Okay.
And this is a very exciting technology.
I'll hold this.
Absolutely. It's known as an intraocular Collamer lens, or other people call it an intraocular contact lens. It's implanted painlessly in the eye in a 10-minute procedure, and it can permanently correct the vision from the inside of the eye out.
Right.
And this is a great technology for patients that are too nearsighted for LASIK.
Well, obviously, this is a model, and it is tiny. It's got to be very, very small to put this in the eye.
Absolutely. So to put that into perspective a little bit, let's take a look at what the size of an actual lens might be.
Okay, so that will actually go in the eye.
That's about the size.
We also have some video we'd like to share with you, and you explain, I believe it's a procedure we'll be looking at. This is incredible. It really is.
Let's take a look.
Let's take a look at it and see what we have. Do we have it? There we go.
So this is 3D animation. Here we're making a small incision in the eye and getting the eye ready for the lens implant, the Visian implant. And again, this is a great implant for patients who have dry eye, so they weren't candidates for LASIK due to dry eye, or they're too nearsighted. And here I'm about to insert the actual lens.
Okay.
The lens is incredibly soft, very thin, and very clear. So once the lens is implanted, no one can tell that you have it in place. And it's carefully and slowly inserted into the eye. And once it's inserted here, my job is to tuck it underneath the iris. And so there's a small space behind the blue or brown iris where the lens is tucked. And again, the patient is completely pain-free during this process. It's a 10-minute procedure.
I was just going to ask you, this is in and out. Each eye is 10 minutes. You're in and out. How about you won't be able to drive when you leave?
You can't drive that day. We do give you a lot of anesthesia so that you're comfortable and pain-free. But as soon as you're leaving the center that day, you will be seeing 10 minutes after your surgery.
Can you expect some blurred vision for a couple of days, or is I mean, obviously the eye has to heal up because it is invasive. But it's within a matter of a few days. You're as good as new, right?
Most patients the very next day are seeing 20/25 to 20/20, and if there's any blurring, it's gone within a week.
How about cataracts?
That's where we've had a lot of other advances, and that's why I brought some other lenses to look at.
Okay.
Cataract surgery has taken some tremendous steps forward, and we now have some lens technologies that can actually allow patients to see far, intermediate, and near after surgery. So no more bifocals, no more trifocals. Patients can see at all distances without glasses now.
Same type of procedure, 10 minutes, pain-free?
Perhaps a little longer, maybe 15 minutes.
Oh, wow.
Pain-free. Big difference.
5 minutes, yes.
Exactly. Now, that was the crystal lens, and that works much like the natural lens does in terms of being able to move. This is another lens known as the Restore. Restore just had a new design, and this lens is absolutely fantastic for avid readers, people who want to read without any glasses. This is a tremendous technology that can be used.
So, doctor, just about any type of eye ailment, we mentioned it a few times, high prescriptions, thin corneas, everything, astigmatism can be treated with this surgery. Thank you so much for coming in.
It's been a pleasure.
It's great to meet you. It is wonderful, wonderful advancement in technology, and come back again.
I'd love to.
Appreciate it. Thank you so much. North Suburban Eye Specialists have locations in Blaine and Coon Rapids. For more information or to schedule your free consultation, call 763-421-7420 or visit NSI eyespecialists.com.